Okay. Hi, thanks for coming in today.
Thank you so much for having me.
No problem. Could you start off by introducing yourself and telling me a little bit about your background?
Of course. My name is Aubrey Lundberg, and I was born in Atlanta, Georgia, and I grew up in Marietta, Georgia, which is a city 20 minutes north of Atlanta. I went to George Walton Comprehensive High School for 4 years and graduated with honors. Before that, I danced for 8 years in a performing company, so I danced every night after school, and I was really active in high school. I joined Habitat for Humanity, Walton Ambassadors Club, so I did a lot of activities in high school.
That sounds great. You said that you graduated with honors. What did that entail?
It had to include a GPA of 3.5 or higher, which I accomplished, and I was also part of Beta Club, which was an activity you got by having a GPA higher of 3.5, and you worked with teachers, and you helped out in the community, so a lot of academic.
That sounds great. Did you do a lot of community helping?
Yes, there was an award for community outreach, which included more than 300 hours, which I achieved. My dance company performed at nursing homes throughout the year, which was a great way to do community service. I also helped out at my church and other organizations.
That sounds great. How did you spend your summer this summer?
This summer, I nannied 2 children. It was a great experience, but definitely tough. Working every day, 6 hours a day, with 2 children that you're responsible for. It's a lot of work. Definitely put in perspective when I want to have children. But it was a great experience, and I love the children and the family.
Did it change your opinions on children? Did you want to have children before and you're not so sure after?
Well, I definitely used to want to have them very early in my marriage, but now I'm thinking I should wait a couple years because it is a full-time job for the mothers. You are never off. You're never having a break. And that is a lot of responsibility that I did not realize before nannying. So it was a good realization.
How'd you get into nannying?
One of my really good friends nannied, and over the summer I know a lot of college kids come back and they work, and it just seemed like a really good thing to do. I love children. I love hanging out with them. I loved planning activities and crafting with them. It was great, but a lot of work.
Cool. That sounds great. I definitely agree with all the things you just said. I see here that you are attending the University of South Carolina. What made you choose to go there?
Well, being from Georgia, most of my high school did go to the University of Georgia, and my mother went to the University of Georgia. So Georgia was definitely a big consideration, but in the end, it just did not seem like the right fit, and I started visiting other schools, and I loved the University of South Carolina. They had a lot of amazing programs here. It's a big SEC school, so I didn't have to miss out on any of that, and it was far enough away from my parents to be my own person, but close enough to be able to come home. So it's a great school.
What were some of the things that University of South Carolina had to offer that interested you here?
Well, definitely number one was their nursing program. I know it's nationally ranked, and it's amazing, and that is another reason why I really wanted to come here.
That's awesome. So are you interested in nursing?
Definitely. It is my current major. I love nursing, so this is a great program to be in.
What made you go into nursing? What interested you in that?
My mother is a heart doctor in Georgia, and so I've always been around the medical field. Medicine has always fascinated me. I've loved the self-sacrifice that doctors and nurses and healthcare providers give for helping with patients. I found that so admirable. But I knew I wanted to have a family. And being a doctor, the long hours and the education, it just seemed not the right fit for me. And I've always loved working with people way more than science. And I think doctors really focus on the disease, whereas nurses focus on the people. And so that was what I wanted.
Well, that sounds great. Do you know what kind of nurse you want to be once you get out of school?
Well, I know clinicals can change your opinion a lot, but so far I really want to work in the ICU or the ER. While I'm young and still have the energy, I want the adrenaline rush. But as I grow up, I want to go back to grad school and be a nurse practitioner. And then I would love to work in dermatology or family care, something 9 to 5 that's very structured.
Oh, dermatology. What made you think that would be cool?
I've always found dermatology fascinating. I think it's exciting without being too dangerous, but I followed a dermatologist before, and I loved her work. I loved how she helped people, and I just really find that fascinating over other practices.
That's awesome. You said that you might also be interested in being a PA. What differs from being a nurse to a PA to a doctor?
Well, a nurse practitioner is a physician assistant are normally the same. It's 6 years of school, but physician assistant more focuses on the science, and nurses focus more on the patient care. And then doctors are above all of them, which they have way more training in science and stuff, which I personally always love the patient more than science. So,
well, that sounds great. What do you do with your time outside of class?
I'm just finished sorority recruitment, and I'm a current member of Alpha Delta Pi.
Congratulations.
Thank you so much. It's a great sorority. I'm meeting a lot of girls, and hopefully I get to be more involved in their philanthropy, Ronald McDonald House, which, as you probably know, is a home away from home for parents who have children in the hospital. And it's a really great way to get involved. I'm also involved in Student Nurses Association, which has a lot of resources for when we graduate. So, great programs.
What has some of Student Nurses Association taught you?
Well, every week they have guest speakers, so that's been really helpful. And they just provide you interview help, resource information, help for externships. It's just a really great program for the nurses here.
That sounds awesome. So Aubrey, what do you think sets you apart from all of our other applicants?
Well, I'm definitely very organized, and I am very great with time management. Dancing in a dance company while being in school, I definitely had to separate my study time from my dance time from school, and so I'm very time savvy. I'm very organized. I keep excellent records, which is good for nursing, keeping excellent records. I'm also very reliable. If you need something done, I will do it. No questions asked. Well, some questions asked. But so I'm very reliable. I work great with others. I'm good. I have very good leadership skills. I'm good at rounding people together and telling them what to do, which goes with organization. Mm-hmm. So I think that I am very good at communication above all others.
That's awesome. You mentioned before that you were a nanny and that you danced in high school. What do you think some of the things that you learned and then doing those things will help you with what you want to be now, a nurse?
I've gotten a lot of people skills. Nannying definitely taught me about responsibility for others, having to take care of 2 lives that weren't mine, and having to make decisions and safety precautions for other people. It really opened my eyes to what nursing will be like, taking care of a person and having someone's life in your hand that's not your own. That's very eye-opening as a nanny. Dance just helped me so much with time management. It helped me. I danced for 8 years, so sticking to something through to the end, that really helped me with it. But overall, I've just gained so many people skills. I made a lot of friends, and it was just great things to get involved in.
Those sound like some great things that you learned there. Where do you see yourself in 5 years?
Hopefully, I'm out of nursing school. I hope to be working in a hospital setting in the emergency room or ICU. And in 5 years, I would love to be back in school for being a nurse practitioner, hopefully. But who knows what will happen?
Who knows what will happen? What are some of your ideal working environments?
Well, I'm definitely big on time management. I'm big on responsibility. So if you're supposed to be there at 8 in the morning, I will be there at 8 in the morning, and I hope my other coworkers will be too. I believe that when you're at work, you should be working, and that is what you're getting paid for, so that's what you should be doing. Personal integrity, telling the truth, being honest to your employers, to the people you're working with. I think that's so important. And I also just believe in, a friendly working environment, no hostility. I am not big on conflict with others, and I hope that other people wouldn't be big on conflict. Just working together as a unit, so much better than working as an individual. I really want a team setting, which is, I think, great for nurses. because we all work together.
Yeah, that sounds great. Well, Aubrey, I really enjoyed talking to you today, and I hope to see you back here soon later.
Thank you so much for having me.
Yeah, thanks for coming.
You done?